This is a presentation on the use of project management for the implementation of health information systems. With the increasing complexity of the medical field and growing options in health information technology, many hospitals are choosing to implement electronic health records. The purposes of electronic health record is to improve the safety and outcomes of patients by reducing medical errors, as well as improving the efficiency of clinicians by minimizing administrative duties and streamlining operations. The implementation of a health information system is extremely complicated, however, and requires an intensive planning process. Once vendors are evaluated and selected, the project must be managed to ensure successful and efficient implementation. Microsoft's Project Manager is a program designed to help managers do so. In the example we will use today, a private hospital is planning to implement an electronic health record on March 3, 2009. In order for the project to be finished, 7 individual tasks must first be completed. These tasks include patient information management, clinical information system, laboratory, pharmacy, radiology, imaging, and food and nutrition services. In total, the project is estimated to take 238 days and will be completed on January 28th of 2010. Each of the 7 tasks have subtasks within them. The patient information management task has 4 subtasks. These subtasks are Enterprise Master Patient Index, Patient Registration, Patient Scheduling, and Admission, Discharge, and Transfer. All these subtasks require configuration and training, except Enterprise Master Patient Index, which only requires configuration. For the subtasks that require training, the training can only start once the subtask is configured. Additionally, the configuration of patient registration relies on the configuration of Enterprise Master Patient Index, which takes 3 days. Once the 3 days are completed, the configuration of patient registration may begin. Furthermore, patient scheduling relies on the configuration of patient registration, as does admission, discharge, and transfer. Because patient scheduling and admission, discharge, and transfer both rely on patient registration, but not on one another, they can both be simultaneously configured. The task of radiology, which requires patient information management to precede it, only has 2 subtasks. These subtasks are general radiology and nuclear medicine. Neither of these subtasks are reliant on one another, and both take 30 days to configure and 5 days to train, so they will occur simultaneously. Imaging is also preceded by patient information management and has 2 subtasks, clinical image viewer and document imaging. Document imaging cannot start until after clinical image viewer is configured, which is scheduled to take 3 days. Then, the 3 days it takes to configure and 5 days it takes to train for document imaging combine, so the imaging task will take 11 days total. Patient information management is also required for the task of nutrition and food services. Nutrition and food services is comprised of the 2 subtasks, food service management and clinical nutrition. Clinical nutrition cannot begin until after the food service management is configured. After a total of 11 days, nutrition and food service tasks will be completed on May 6th of 2009. The laboratory task is dependent on the completion of the first task, patient information management, and thus will not begin until April 22nd. Within laboratory, there are 3 subtasks, chemistry, microbiology, and anatomic pathology. After the 10-day configuration, the chemistry and microbiology subtasks can be configured, and once chemistry and microbiology are both configured, pathology can begin. The subtask will take a total of 35 days to complete. Once all the subtasks of laboratory are configured, the pharmacy subtasks may be implemented. These subtasks are inpatient and outpatient pharmacy, electronic medication administration record, and adverse reaction tracking. Adverse reaction tracking is dependent on the completion of the other 3 subtasks. Additionally, inpatient and outpatient pharmacy precedes medication administration record, which precedes medication administration. Overall, the pharmacy tasks take 58 days. Lastly, the task Clinical Information System can begin once all of the other six tasks are configured. Clinical Information System is the longest task with 10 subtasks that take 119 days to complete. As the table shows, the 10 tasks are Clinical Alerts and Reminders, Clinical Rules Engine, Consult Tracking, Order Management, Results Reporting, Clinical Documentation, Computerized Provider Order Entry, Intake and Output, Patient Education, and Vitals Measurements. Many of the subtasks require completion of configuration of various other subtasks, and thus Clinical Information System is a very complex task to complete. Overall, Microsoft's Project Manager program is a useful and efficient way to manage the implementation of a health system. It is a standardized approach that allows for the scheduling of the project, as well as making projections and project deadline estimations. Additionally, the program is fairly simple to use and easy to adjust. If changes need to be made, the project timeline, they can quickly be reflected in the program. Also, the program provides a clear way to see which tasks are reliant on the others. This is not only helpful for organizational purposes, but also to help explain the project's complexities to stakeholders. The program is not perfect, however, as it is time-consuming to learn. Additionally, when a project has many tasks and subtasks, it can be very complex to enter. Lastly, the project manager cannot account for some of the obstacles encountered in a real-life scenario. Despite the cons, the Project Manager program is a beneficial tool for managing the implementation of electronic health records and should be utilized by those responsible for similar projects.